For many teens, residential care is a last resort, a place of immense emotional and behavioral challenges. But one therapy is linked to drastically reducing the need for physical restraints, seclusion, and sedatives. The impact is profound, with studies showing up to a 75% reduction in anxiety and depression symptoms. It successfully reaches teens who are often resistant to traditional talk therapy, opening a door to healing. Next, we'll show how art therapy works, from rewiring the brain to giving a voice to the unspeakable. So, why is a different approach required? For teens in crisis, especially with trauma, words can feel threatening or just fall short. Art therapy supplies a safe, alternative outlet to express complex emotions without saying a single word, bypassing direct disclosure. And this isn't about artistic talent. The focus is entirely on the process of creation in a judgment-free zone, removing any fear of failure. In a structured setting, art provides a rare space of autonomy. The teen controls the materials, the pace, and the message. This foundation of safety and control allows for deep changes. But the benefits are not just feelings. They are rooted in brain science. How can making art have such a significant biological impact? The answer lies in neurobiology, particularly in how the brain handles trauma. When a teen creates art, it is a neurological event. But how does a drawing actually start rewiring the brain's trauma response? First, the physical act of making art regulates the amygdala, the brain's alarm. This calms the fight or flight response that is often stuck on. This process stimulates dopamine and neuroplasticity, the brain's ability to form new connections, rebalancing functions compromised by trauma. This is why art is so effective. It allows teens to externalize traumatic memories and sensations that words simply cannot reach or contain. This neurological process produces powerful, real-world breakthroughs in communication. Let's look at what that means in a therapy session. Some things, like abuse or family secrets, children are conditioned not to say aloud. Art presents a loophole. A teen can draw what they cannot speak. This gives therapists an uncensored window into a teen's mind, revealing concerns too scary or embarrassing to say. Unlike a conversation, art is a physical record. Teens and therapists can review past work to measure progress and gain new insights. For teens struggling with self-harm, art is a direct intervention. Sculpting can channel painful emotions into a productive, non-harmful act. So, to answer our question, the brain is rewired by this process. Externalizing trauma visually and creating new narratives loosens the amygdala's grip. Art therapy does not work in a vacuum. It integrates well with established methods like CBT and DBT, forming a more complete treatment plan. Beyond processing the past, it also builds skills for the future. The creative process itself awakens problem-solving abilities for life's challenges. Every finished piece fosters a sense of accomplishment. This directly boosts self-confidence, with 79% of participants reporting a better self-image. But how does this confidence build a stronger sense of self? For many teens in care, their identity is defined by their diagnosis or trauma. Art therapy supplies a safe lab to experiment with new identities: the artist, the creator, the storyteller, away from social pressures. Let's connect these threads. We've seen the powerful outcomes, the brain science, and the development of new practical skills. Remember the huge drop in physical restraints we started with? We now see it's the direct result of calming the brain's amygdala. Calmer brains mean calmer behaviors. Communicating the unspeakable does more than release trauma. It rewrites a personal story. Teens reclaim their identity from past events. The problem-solving skills learned through art become lasting resilience, turning therapy into a lifelong, healthy coping mechanism. So, art therapy is far more than a recreational activity. It is a sophisticated, evidence-based treatment with neurological and behavioral benefits. It supplies a voice for experiences that are beyond words. It calms and rewires the traumatized brain, and it builds confidence for the future. For administrators, the evidence is clear. Investing in qualified art therapists means investing in better outcomes and lower crisis incidents. For parents and therapists, this information provides the evidence to advocate for art therapy as a standard component of care. Ask for it and support it. Through the power of creative expression, we offer our most vulnerable teens not just a way to cope, but a way to create a new vision for their lives.